So, thank you all for coming. I'm Rick Kranz. I'm a natural hoof care provider, professional. A little bit of background. I have a degree in equine science, certified hoof care practitioner. Both achievements were through the Equine Science Academy, probably the best horse health course that you can take. It's not just about hoof care. They cover a whole array of different things. You actually study farrier science, horse behavior, and a whole array of different classes. It takes a good, if you really stay at it, you could probably get it done in a year, but it's more like a course that probably can take you up to 3 years or more. So it's very intense and very informative in there. Just a really good place. I've studied with other mentors that are well known. Pete Ramey is a very well known person. He actually helped start the Equine Science Academy. The CEO or administrator of ESA started Pete Ramey out in his career in natural hoof care. I've studied with Jamie Jackson's books and another very well known one. Let's see, who else? Dr. Bowker, Casey LaPierre, just to name a few. I've got a lot of books up here, and then you're welcome to look through and check it out. And I continue to learn. Like I said in the discussion before, I'm working on becoming a field instructor with the ESA, and I have studied courses with the, Equine Cushing's and Insulin Resistance Group. Had a course with them about nutrition, which is very, very important for what we do. I've been mentored by a mentor with Preventive Hoof Care Practitioners, and they're another group similar to the Equine Science Academy, and I would recommend either one of those if somebody was wanting to become, involved in hoof care professionally. I think that's enough bragging about me. I want this to be as informal as we can make it. In other words, I just want to talk to one another about issues that you might be having and questions that you might be having. We're going to, I think I'm going to focus a lot on lameness issues such as laminitis and navicular, maybe a little bit on club foot. I don't know if we'll get too much into that because it's very similar, or the symptoms are very similar to laminitis. So fire up your questions. If there's anything that you want to jump into first, if you have a limited time and you have to get going, speak right up. Otherwise, I'll just jump in and we'll go to town. Sound good? Anything you want to start out with?
Just my own horse. He wasn't, his toe was real long.
Okay.
And so we got x-rays, and the farrier saw that it could be a lot shorter.
Right.
And he went with that, which was great. But the part, would that be his frog? Or the back part of his heel, I guess. His heel wasn't touching the ground.
So,
and so
let me get this cadaver, and maybe you can kind of bring up.
Yeah,
the memory.
so this wasn't touching the ground.
This part.
Right.
The frog.
Mm-hmm.
Okay.
And so he put some corrective shoes on him to allow this to grow.
Okay. And when they did the radiographs, did they mention anything about a rotated coffin bone or anything like that?
No.
Okay. So that's going to put me right into foot function rather than into laminitis,
Okay.
or to help answer a lot of the questions that you're talking about. And this little, we're not going to be able to see it on the video. But this is simulates what the horse's hoof wall does as it loads up, as it puts weight on it, okay? So this is your hoof wall, and this simulates when the horse puts weight on the foot. And you'll notice how see how it expands? Okay? So it's designed to expand, and it expands this way. Also, in a natural foot or how nature designed it, there's a little bit of an arch right there. Okay, so as that horse lands, the back of the foot flexes, and as it's weighted, then the foot will go flat this way, and then it will expand this way. And it needs to do that, and you can refer to the handout, the hoof mechanism. So I'm not going to go over that diagram because it's kind of a little bit hard to understand. But it's very important for the foot to be able to function. Because if it can't function, it's not going to get blood perfusion. And if it isn't getting blood perfusion, then the foot is more or less is going to go numb. So they can't feel their foot. Okay. And also, let's say, I'm trying to get maybe ahead of myself. And yes, now I know where I was going with that. Also, when you put an iron shoe on that, and this is an iron shoe, and then we have the hoof wall, there's no function. It's shut down. So the foot isn't able to expand, and it isn't able to flatten. So if it can't do that, then the frog isn't going to be able to move because if the foot won't flex, the frog isn't going to be able to make contact with the ground. Does that make sense? Yeah. Okay. So that's a problem when you use shoes. So that's one of the reasons I don't use shoes, is because I want to develop that foot so we can have function. If the frog isn't getting any exercise, it's going to continue to atrophy. It doesn't grow on its own. It has to have movement, flexation, and those kind of things. That makes sense. Mm-hmm. If it doesn't, if you don't use a muscle, you break a leg or an arm, and you don't use those muscles, it's going to atrophy. The same with the foot, and all those internal structures will atrophy, frog included. So that's why we don't see a lot of success with shoes and frogs. The frog may grow down, but it's still not functioning. And part of the function of that frog is to help that foot expand.
When the frog hits the ground, does that shoot blood back up? Or where does the blood go? Yeah, maybe you're going to cover that.
Yep, we're going to go there.
Okay.
But that's a really good question because that's what we've always been taught over the years. The frog is the pump. It's the fifth, or one of the four hearts besides the heart up here. Well, the whole hoof is the pump. And then when you can really look through this, it took me about 6 times before I knew it was going on, but it took me about 6 times of reading this diagram to really understand what Jamie Jackson was actually telling me. And I also had to study what Pete Ramey was saying, what Dr. Bowker was saying, and all these other people, and gather up all that information and put it all together so that would help me understand, what's going on in the foot. So it really helps to study other people and what they're talking about. So I'll kind of hold on to this to give you a little security. So when the hoof is off the ground, that's when it's in this contracted state. It's contracted, the hoof is collapsed, okay? As the foot comes down and does a heel first landing, it helps expand the heel like what we were talking about. And when the heel expands, that lets the arterial blood into the foot. Okay, if it's contracted, not a whole lot of blood is going to get into the foot. It's just not going to happen. You know, it's just not built that way. So how is the back of the foot able to expand? Is because the back of the foot is, for the most part, soft tissue. Okay, the front part of the foot is it's supported by the coffin bone, and the back of the foot is supported by the lateral cartilage, the digital cushion. I don't have an example of a digital cushion, and the frog. Okay, so when that foot lands, those are still soft tissues, so it's able to expand, and it's also able to take that arch away as it loads. Does that make sense? If it doesn't make sense, please ask, because this isn't about me teaching you and you go, you know, yeah. Please ask, because it's very important that horse owners understand what's going on with their horse's feet, so you can communicate better with your hoof care provider and your veterinarian. When they explain something to you, you're gonna understand it a lot better. So, so we know when the foot's fully as the foot is fully loaded, arterial blood comes into the foot, and as the heel expands, the cornet band contracts.
Okay, gotcha, the front.
The coronet band up here,
Gotcha.
all the way around the top of the hoof wall.
Okay.
It contracts, and it doesn't allow any blood up the foot. It's allowing blood into the foot.
Okay.
Okay. And then there's this split second in time as the foot is fully loaded, because all this pressure is coming into the foot. Okay. And it's not being allowed to leave. So it's only going to get pressurized up to 80 psi, let's say, or 180, whatever you like. I mean, it's only going to allow so much blood perfusion or blood pressure into the foot. So it's loaded. And at that time, it becomes a shock absorber. It absorbs all the concussive forces.
Does all that blood help the shock absorb?
Absolutely.
Okay.
Yep. The whole foot, everything becomes a shock absorber. Okay. Just think about it like a car shock absorber. As your car hits a bump, it absorbs that shock, and then at a point in time, it won't take any more pressure, and so you're stable. So it stabilizes the bottom of the foot, dissipates the concussive forces. Okay, so when the horse starts to break over, the heels contract, release the pressure from the coronet band, and the blood goes boom. So pressurizes and then depressurizes, and the blood shoots up the foot.
Cool.
That's how the blood perfusion works in the foot. And these things are backed up by almost every hoof professional in the field.
So question then, so they've got a shoe, an iron shoe on, they land, then you're not getting, I understand that it's restricting that arch, so you don't have that coming down. So then you're not getting all, I mean, what happens when you've got a shoe on?
So what's going on when we have a shoe on, and again, it's explained very well in Jamie Jackson's diagrams in the hoof mechanism. So when you have a shoe on there, like we talked before with this example, it won't do this. It won't flex out this way. And remember, when you're having that heel first landing, the heel expands, the blood perfusion comes in.
Okay.
Okay. And also, it doesn't allow that arch in the foot. You know, when they nail on a shoe, they take the arch of the foot, they pretty much take it away because they have to have a really flat surface to be able to nail the shoe on. You don't see too many horses that will have an arch between the shoe and the horse and the hoof wall or the sole of the foot. If they did that, that would cause the horseshoe to loosen up fairly quickly, and they'd be replacing shoes quite a bit. And this is really important, okay? Because like I said before, the lateral cartilages or the other soft tissues in the back of the foot are the structure for the hoof wall in the back of the foot. In the front of the foot, you have the coffin bone structure. So you guys with me?
Mm-hmm.
It's making sense?
And what's that, what's the structure on the side called? Did you say that, what's that?
Lateral cartilage.
That's lateral, okay.
Okay? And it's very flexible because it's cartilage. So when you take that ability to away, we're going to end up with another similar thing that you've seen. It's going to atrophy. Lateral cartilages are going to get smaller. Digital cushions are going to get smaller. Frogs are going to get smaller and weaker because they're not getting exercise. One of the biggest problems that we have in the horse world right now with lameness issues is young horses do not get to develop their feet. They're very restricted in their movements from almost day one. In the wild, Pete Ramey has done studies, Jamie Jackson has done studies, David Landerville or something like that, he's done wild horse studies. And them horses, when they're born, within 2 days are up, moving, and going 20 miles a day, 15, 20 miles a day with their moms and dads and uncles and aunts and brothers and sisters. So, so this is a little baby Mustang horse. Okay, and this baby, when it perished, was probably only 4 or 5 years old. I don't know if I have. Yeah, I do have it. This is the domesticated horse, an adult horse, and this right here. You can see that little spot right there,
Yeah.
right?
Uh-huh.
And right here, you see the same spot. This baby's digital cushion is really not that much smaller than this adult horse.
That's the digital cushion right there.
Right.
That spot, right?
Right.
Okay. Wow.
So a lot of people think the heel bulb up here, where the big round spot, is a digital cushion. It's part of the structures, but it's actually not the digital cushion. The digital cushion travels underneath the foot and starts coming around to help form the heel bulb. In our domesticated horses have very underdeveloped internal structures in their feet, just for the fact that they don't get the right movement and are able to develop when they're very young.
But if they're young and they're not putting, is that just because they're moving less? Because they're not putting shoes on them that little, but are they just not moving as much?
This doesn't really have anything to do with shoes.
Okay, that's just they're not being used as much.
They're
not moving.
They're not developing their feet.
Because they're not moving.
Well, actually, they're not developing their whole body. This isn't just a hoof problem. It's a whole horse problem as far as development of their whole body.
Okay, because they're not moving as much.
Because they're not moving as much as they would out in the wild. So what's happening when those little babies in the wild, they get up, they take off, and the digital cushion is pretty much nothing but a little big piece of fat pocket. And all the nerve endings or proprioceptors are in there. Go ahead.
No, I was brushing my hair out of
Oh.
the way, excuse me.
Okay. Are in there, but if they were all out throughout the foot to begin with, babies wouldn't be able to get up and move because it would hurt because they're not developed. Does that make sense to you? So as the horse in nature gets older, because they're developing those internal structures, and I'm going to add all the internal structures and together, the lateral cartilage, the frog, you know, the frog corium, the sole corium, all the internal structures. So them horses in the wild or in nature are developing fast because they have to. Otherwise, predators would, you know, they wouldn't last very long out there. And so as they get older, those nerve endings and proprioceptors and everything like that start growing and intertwining in with the digital cushion. Okay, with our domesticated horses, they're not getting that development. So the nerves and proprioceptors and so on and so forth, they're not getting developed, and that cushion just kind of stays like a little fat blob. And then as they get older, they start putting on weight because they're getting bigger. It's, you know, they grow. So when they get older, they start putting weight on that foot like nature intended them to do, but now it's starting to get painful because they don't have the development of the internal structures in their foot like they would have if they would have got the proper movement as they're growing. So then we start developing issues like navicular and even laminitis. We'll talk a little bit, we'll try to get into laminitis pretty good here too, because it's a very important subject. So that's where most of our lameness issues, in my opinion, start with. 2 days after they're born, they need to be given movement, let them run out and play. We worked at a place that had $100,000 horses, and the ones that was going to be worth the most never got out of a 12 by 12 stall because they were protecting their investment. So
Ironic.
we weren't there long enough to look at the results of those kind of things, but it was really hard to watch that. So let's see, we covered the foot function, the importance of starting colts with movement ASAP. Does anybody else have any questions on that part? Good to go? Right on. So let's talk about laminitis. And I'm kind of opinionated on what laminitis really is. There's debate whether it's a metabolic issue, like diabetes or insulin resistance or those kind of things. Some people claim that it is caused by bad trimming practices, and it's a mechanical thing that separates the laminin and causes laminitis. Other issues can be attributed to it, like Cushing's, stress. But anyway, there's one thing for sure, it's really painful. And I'm going to kind of make a simulation here of what's happening with the laminin in the hoof wall. And it doesn't sound like this, but the sound I want you to imagine the ripping and tearing and how painful that must be. And that's what's happening in the layers of the lamina. And it's like bending your fingernail back and tearing your fingernail back. When that happens, it's pretty much over. It's painful for a long time. But with laminitis, that ripping and tearing is constant. It's 24 hours a day
With each step?
with each and every step.
And does it usually affect all 4 hooves?
It can. Primarily, we see it in the front feet. Okay. The reason is the hind feet are much more capable of taking care of themselves, just for the fact that it's not as easy for them to limp on their hind feet. I mean, it has to be a tremendous amount of pain. When it's their front feet, it's much easier for them to go ow, 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 ow. That makes sense? Okay. So, I gotta backtrack a little bit. So, when we're dealing with laminitis, the 2 important layers, oops, find this a cadaver again, are the epidermal layer.
Maybe we'll sit closer. It might make it
Yeah, come on
easier.
up.
No, we'll
Like I said,
if we
this,
sit
yeah,
closer,
I
then
want
you
this
can-
to be informal. I don't
then
want
you
it
can-
to
then you
sound
can
like
just
it's
show it
a
once.
lecture or anything.
That's great, then it'll just be easier for you to explain it.
So we have 2 main layers, is your epidermal layer, the outer layer, and we have a dermal layer, and that's the inner layer. The obviously the epidermal layer is the hard horn, and that's the part that grows down that we trim. The dermal layer, that's what holds all the blood perfusion and the nerve endings. Okay, and there's another little very important layer in between them that puts this, gives that horse's hoof wall the ability to grow down. It's called the basement membrane. Okay. The basement membrane, the cells are able to, I guess the best way to put it, as they die off and regenerate, when they die off, the hoof wall's grown a little bit, so it slightly loses a connection, so it can grow down. Okay, and then it regenerates, and then helps keep that connection together, and it's very, very strong. When we have a laminitic episode or event, the basement membrane fails.
What's that membrane called? The
Basement membrane.
basement membrane,
Okay. So when that basement membrane fails, it's dying. So then the hoof wall, the epidermal layer, the outer hoof wall, starts sliding down the foot because it doesn't have that good connection. And when you see horses that have, a lot of times they're referred to as growth rings. And this horse is actually an old wild horse, so this kind of debunks the idea that wild horses don't experience founder and stuff like that. There's never been an account of a wild horse ever having navicular, but as you can see, each one of those rings is when they had a laminitic episode. Okay, but this doesn't mean if your horse has growth rings that it's, oh my God, my horse is going to get founder and coffin bone's going to rotate and we have to go through all those things, because there's so many things that can cause a laminitic episode, like we discussed, metabolic issue, mechanical issue, or an issue like with Cushing's.
So what you're saying is like, right, that basement membrane is just kind of right in here, and then that's when the dead stuff can grow out.
No, the basement membrane is a completely different layer.
Yeah.
So,
But it only goes like, if you're doing cross-section, does it go, how far
no,
down does it go?
it's microscopic. It's in the whole hoof wall, all the way down.
All the way
to
down,
bottom.
okay.
So,
But it starts to die off halfway through?
no,
No, okay.
it is dying off and regenerating